The latest Uganda demographic and health survey shows that 1 in 4 girls between the ages of 15 and 19 is either pregnant or has had a child. The survey carried out by the Uganda Bureau of Statistics also shows that 20 women die every day due to pregnancy and childbirth-related complications. A big percentage of the deaths are said to occur among teenage mothers below the age of 19.
Sometimes they get deformed, they may get unsafe abortions, they may get fistula, they may find themselves unable to have children in the future.
In most cases, they don't just stop at that first child. So there will be young mothers having children to take care of. And as we see it, there's this vicious cycle whereby when they do have kids at a young age, the kids themselves are not well catered for, and eventually those kids will also become young mothers, and so the cycle is very vicious.
Experts are calling for a reduction in maternal mortality in order to achieve safe motherhood. Advocates of family planning recently mooted the idea of providing contraceptives to the youth at the 3rd Family Planning Conference held in Ethiopia capital Addis Ababa.
For as long as we have teenage pregnancy in the kind of epidemic we have it in this continent, violation of the rights of the girl child, we're not going to get there. But I believe we can, and I believe we will. I don't think there's any parent in this audience who will be happy to see his 11 or 12-year-old get a fistula.
Most Ugandan youth find it very difficult to access family planning contraceptives due to the high costs and, in some instances, the negative stereotypes attached to those who acquire them. Joan Bananora is a youth volunteer who shares some of the hardships that the youth go through in trying to get contraceptives.
There are usually 2 pills. As I've done my research, there are 2 pills, and they are 5,000, from 5,000 up onwards. And a young girl who has been gang raped in the village, the parents are poor peasants. They cannot afford 5,000 to just buy a pill, to just buy 2 pills to help this child's future. That 5,000 can buy a meal at home.
Some of the resolutions at the conference seek to make contraceptives accessible to the youth.
Of course, as young people, there are some contraceptives that would not be fit for them. As young people, I mean, like tubal ligation or things like that, because that means they are permanent methods. The commonest reason people get problems with fertility following a contraceptive is the feeling that contraception releases them to have illicit sex, and they have multiple sexual partners.
The resolution was backed by leaders, giving it the political will that has for long been lacking in family planning interventions.
We are going to find youth corners. See to it that at every health facility we at least have this service available, as is the case in Ethiopia. Of course, we have them within the central region, but we've not scaled it up to the other districts.
No, my Minister of Finance, we are in line with what our President committed himself in the London conference. We will definitely be providing funds to Minister of Health for them to be able to roll out the family planning programs and supplies, so that those who want to access to them can access to them.
As delegates from over 120 countries, including Uganda, agree to extend family planning services to young people, Uganda is faced with the challenge of the attitude society holds towards sharing issues concerning sex to the young people. This move has been criticized by advocates of morality as promoting promiscuous behavior among the youth, a criticism that experts say is not lost to them.
We really need to stress that it is not as good and cannot be better than prevention. That still prevention, first of all, is more efficacious. If you don't have sex, then you don't have to get worried about anything else.
I mean, there's no one particular way or one way that we should use. We should use like a combination of approaches to be able to reach the youth and adolescents.
Health experts believe family planning is the most cost-effective way of controlling maternal and infant mortality. Irene Namialo, NTV.